Should we be worried about chronic or long-standing gastritis? That's the topic today. We all know you have a food pipe and stomach. Stomach is the organ where the active digestion part is happening. So, and most of the nutrients are absorbed. So, what is gastritis? Gastritis is nothing but inflammation of the superficial lining cells. It's like a raw area inside the stomach. Suppose you have a raw area. Suppose you hurt somewhere and you have a raw area. So, the same way, there is a raw area that's called gastritis. The only difference between external and internal is there is acid inside the stomach. So the acid can irritate the inflamed area. So that is chronic gastritis. Okay. So when this chronic gastritis happens, the next level is because of the acid, and if suppose they have a H. pylori infection also, they can lead to ulcer, peptic ulcer, gastric ulcer. So these ulcers can cause pain, nausea, vomiting, all these things. Apart from that, these ulcers can bleed. So when it bleeds, most of the time they will vomit blood. If not, most of the time the bleeding will be seen as a black color motion. So the blood goes down and changes the color into black and tarry black stool. So that means internal bleeding. This is the second thing can happen. The third very important thing is on repeated this gastritis and healing, or the ulcer when it heals, it forms scarring. This scar can, when a long-standing scar, the outlet of the stomach can be obstructed. That's called gastric outlet obstruction, and so they will have a vomiting, bloated. They can't pass motion. All these things can happen. The next is the cells over a period of time, repeated injury, repeated acid attack, and cell can the changes can happen in, that's called metaplasia. This metaplasia can lead into a pre-cancerous condition, or even rarely can turn into malignancy. So these are the main side effects, or if we neglect the chronic gastritis. The next is nutritional deficiencies. Because of the chronic pain, they'll start avoiding the socialization, and not only that, they avoid taking they will choose, they will be very choosy about the food. So mostly they will choose a simple steam cooked or easy to digest food, like curd rice or idli with sugar. So what happens, though they may get calorie, but the nutrition deficiency can happen, especially vitamin B12 and iron. Because B12, because of the autoimmune gastritis, the lining cells are destroyed. That is where the iron and B12 are absorbed. So B12 deficiency, iron deficiency, not only that, even calcium, all are mainly, all minerals are mainly absorbed in the stomach. So these minerals can also go for deficiency. And apart from that, they can go for weight loss, because they will be very choosy on the food. They reduce the quantity. So that can lead to weight loss, muscle loss, tiredness. All this can happen just because of the chronic gastritis. That is why if you have a long-standing gastritis, definitely you have to approach your doctor. He may ask for endoscopy and other tests, and you will always look for the iron deficiency or nutrition deficiency. And anyone with unexplained weight loss, the first is always endoscopy to look for is a simple gastritis or some other issue. So chronic gastritis is a long-standing abdomen pain which cannot be neglected. Consult your doctor and get the proper treatment.